Davis. I'm a scientist, a geneticist, a science communicator, and a mom of 3 young children who are trying to keep quiet for you right now. So hopefully that will stay that way. And I'm joined by fellow nerdy girl, Dr. Malia Jones. Malia is an infectious disease and social epidemiologist with an MPH and PhD in public health. When she's not volunteering as a nerdy girl, she's an assistant professor at the University of Wisconsin-Madison.
Hey everyone, I'm excited to be back today.
So I want to remind you before we jump in that nerdy girls don't take questions cold. That way we are always sure to have the latest and greatest research at our fingertips. So we encourage you to submit your questions in the question box on the Dear Pandemic website at dearpandemic.org. So let's get started right away with something that's not COVID, monkeypox. Dr. Malia Jones, here's the first question for you. What is going on with monkeypox and how worried should I be?
Yeah, this is the question that's on everybody's mind. We picked out some great questions out of that question box this week. So, and this does seem to be one of the big ones at the moment. So I think there's a kind of a disconnect going on between what is really happening with monkeypox and the narrative that's flying around on social media and official news media too. And I think what's going on is that we have all been through this really wild ride over the last 2.5 years, seeing how a new virus can disrupt, turn society completely on its head. And a lot of folks have learned all this new to them epi terminology like R naught and incubation period and efficacy. So we all have this additional infectious disease epi knowledge compared to before COVID-19. And so I think this new virus is like, oh my God, here we go again. What is happening with this? But here's the missing piece of this puzzle. What we never learned in the news cycle about COVID-19 is that the specifics of a disease matter a whole lot when it comes to the particulars of an outbreak, and especially how the disease is transmitted. Because we're only dealing with a respiratory virus, we really only learned about a respiratory virus transmission route. Monkeypox is not transmitted the same way as COVID-19, and it's really different in other ways too. So monkeypox is a virus like SARS-CoV-2, and that is one similarity. However, it's not transmitted through the air. It is not transmitted through respiratory droplets, at least not in typical situations. And it's not even usually transmitted through normal, casual, shared surfaces like touching a doorknob that somebody else touched or touching gym equipment. It's typically transmitted through prolonged, direct skin-to-skin contact with an infected person's rash. And so I'm going to quote the formal documentation about monkeypox here. It says, monkeypox can spread to anyone through close, personal, skin-to-skin contact, including direct contact with monkeypox rash, scabs, or body fluids from a person with monkeypox. And this kind of direct contact can happen during intimate contact, including sex, prolonged hugging, massage and kissing, and prolonged close face-to-face contact. So, theoretically, it can also be transmitted through direct skin contact with something that has recently been in contact with an infected person's rash, like a towel or something, but that's going to be less common. So yes, there's a huge monkeypox outbreak in progress worldwide. 10,000 people in the United States have been diagnosed with it, and it's not nothing. I mean, it's a big public health problem, but it is not COVID-19. I think that looking at back to school, the chances of children getting infected with monkeypox during soccer practice or math class are extremely, extremely small.
Can I jump in with something? I think it's a great point you made about this new knowledge a lot of people have about, viruses and just sort of some more vocabulary there. And I wonder if some people are thinking right now, well, we said this about COVID before. We didn't really emphasize the respiratory spread initially, but then, there was more emphasis on the hand washing and surface contact. And then there was a lot more emphasis on the respiratory later. So are we going to learn this, suddenly that we were wrong? And I think it's worth speaking to like the fact that monkeypox is not a novel virus.
New.
Yeah,
it is not a new virus. So at the beginning, back in March of 2020, when everybody was emphasizing hand washing, we were looking at other coronaviruses and the way that they spread. for reference. And some of them do spread sometimes through, touching a doorknob and then putting your finger up your nose. So there was a lot of emphasis on surface transmission. Then that turned out to be incorrect. And, a lot of other things we initially guessed about COVID-19 turned out to be wrong too. We didn't know anything about COVID-19 in March of 2020 because it was like brand new, right? Literally nobody knew anything about it.
Yeah.
Monkeypox has been identified since the 60s, and it's not new at all. And there's already a vaccine for it. We do know how it's transmitted. There's like a theoretical possibility that you could through respiratory routes if you did something like took an infected person's bedding and shook it out really hard and then breathed in all those dust particles that came off it. But like typical, like you're not going to see a super spreader event on a bus with this. It's just not the way it works. So it is a public health problem. It is not the next pandemic, right? I think it's really being a little bit, people are really in a panic about it. So what can you and I do to protect ourselves against monkeypox? Well, for kids and in school settings and grocery stores and all the typical places we go in a day, the main thing really is to wash your hands. This is a pretty straightforward prevention technique. You can prevent it with hand washing in most situations. And I don't know, we don't all need to get a monkeypox vaccine. Some people do need to get a monkeypox vaccine, and the CDC has some guidance for who those people are. They're people who have higher risk sexual practices, and I'm going to link to their guidance. Key tips for that population include seeking out a vaccine first, also exchanging contact information with any new partner so you can follow up if a rash does emerge. Temporarily avoiding places where you would have prolonged skin-to-skin contact with people, knowing what the symptoms are and taking care of them if any of them emerge. And importantly, if you have any of the symptoms, definitely avoid sexual contact with anyone else. So I'm going to link to this guidance, and I just have to put a content warning here. It's kind of amusing, actually, but this is the most risque CDC guidance I have ever read. So enjoy. And yeah, those are my thoughts about monkeypox.
Just one question from the question box, if you could address it quickly. Do we know, is monkeypox somehow behaving differently? So why now? Why are we seeing it in non-endemic countries? What do we know enough? Have good information on that yet?
I don't think that the virus itself is actually behaving differently. I think we had some bad luck where it really started spreading within certain social circles. Emerging evidence suggests that it started in Spain at some festival events and, really got sort of a good grip on a new population and started spreading within that population undetected for quite a while. And so the virus itself, I don't think is behaving any differently, but it is in a new population group. And so that's why we're seeing it, in all of these places around the world, thousands and thousands of cases where we have never seen it before. The virus itself, I have not yet seen any evidence that the virus itself has changed.
Okay. You want to throw one at me
now?
All
right. Yep, I've got one for you. I just need to find, oh my gosh, I have so many windows open and I clicked off it to put that link in there. Okay, here we go.
I got it. We did prepare.
Oh, we did. Oh, excellent. Okay, so what is going on with COVID rebound after Paxlovid? Should we avoid taking it? My family, actually, someone in my family just experienced this last week. And we have a lot of reader stories about this where someone got COVID, got Paxlovid, was testing negative, and then a couple days later, testing positive and feeling bad again. So what's up with this?
Yeah, we probably all know someone by now who's had this, and including, fairly well-known characters like Joe Biden and Tony Fauci. So this is, everyone is very aware of this phenomenon right now. And so it is a real phenomenon, but I think this whole story also speaks to kind of the way that social media can misconstrue frequency of events, because it's the kind of event that rises to the surface and people do talk about it when it happens, but you don't necessarily hear from all the people that didn't rebound, right? So when we think about how common it is, it's easy to think it's actually more common than it is. So But as you said, what this is, it's when the same infection, you think it's gone, but it comes back. So it's not that you're getting, a new case of COVID or even a mutant case of COVID. It's actually basically the exact same virus coming back. So I think the most important thing to know right now is that Paxlovid is still recommended for high-risk individuals who are at high risk of progression to severe disease. And that's why these, well-known characters are taking it, because it is still recommended. It's still a very excellent treatment, preventative treatment to avoid landing in the hospital. So it's still working. It is still recommended. So that's, I think, the most important thing to know. But the other thing to know is that there can be a significant delay in the rebound. It can be, you feel better and you're testing negative, and then 9 days or even longer than that afterwards, it comes back. And that is still a rebound. That is not a new infection in many cases. Another super important point is that you can spread it during rebound. We don't know if everyone is contagious when they rebound, but we definitely have case reports. And one that really sticks out in my mind was a grandparent who gave it to his grandchild, 10 days after he thought he was better. It's very reasonable to think, I'm done at this point. But then he tested positive the next day and had spread it during that encounter. So you need an extra period of vigilance. And in terms of what to do about it, I think rapid antigen tests.
Can I interrupt you for just a second?
Yeah.
The other thing that I've been thinking a lot about with this Paxlovid rebound, especially in light of the new CDC guidance, which I was just torturing myself with this morning, the people who get Paxlovid are also the people who are the highest risk for a regular rebound and for having a prolonged illness, right? So yes. I think there's also something there where it's like, well, I mean, this is the same population group who might have actually been contagious for 15 days already. So
yeah, exactly. I'm going to speak a little bit after this about what we know about rebound outside of the context of Paxlovid. And it does seem like rebound rates vary depending on the population, depending on the variant. And it may be that the people who take Paxlovid are just, as you said, they tend to be older, they tend to be more vulnerable. So we're seeing elevated rates, not necessarily because of the Paxlovid, but because it's the population and we're looking for it, probably a combination of the two. So you could be contagious. It's worth monitoring. Rapid antigen tests are a great way to monitor for rebound, because not everyone is symptomatic. Rebound also includes just a positive test without a resurgence of symptoms. And currently the guidance is that if you do experience rebound, you don't necessarily need to jump and get another Paxlovid round. The default is that, from the most cases observed so far, people have, been able to clear the second infection without needing a second round of Paxlovid. So don't assume that you need another round. How common is it? We don't really know the answer yet, because the numbers are varying from study to study, and some of that's probably different definitions of rebound, and some of that's probably the specific population and the viral variant circulating at the time. So initially, in the Paxlovid trials, they saw around 1 to 2% in people treated with Paxlovid, and also people did not treat it in the control arm, 1 to 2% rebound. But a recent study found 5 to 6% rebound when they did a trial with Paxlovid and also, I don't know how to pronounce this one, molnupiravir, however you pronounce that, another antiviral. And the rebound rates in both cases were 5 to 6%. So again, this speaks to it's not necessarily a Paxlovid-caused phenomenon that we're seeing. And there was another study that so I'll link, just first going to link quickly to an article that I wrote for Dear Pandemic with some more information and links to those studies and so on about the rebound. To put that in there. Oh, it says, sorry, something happened with my can't post. Oh, that's fine. Okay, so yeah, that's the article that I wrote with more information about the rebound. And then in terms of when you're not taking Paxlovid, there was another study, a preprint that came out, and they basically looked at the control groups of several antiviral trials and kind of pooled the data from those. And they found that 27% of people rebounded just in terms of symptoms reappearing after the symptoms were getting better. So that's kind of like you're on the right trajectory, and then all of a sudden it kind of gets worse again. So that's a very common occurrence. And then about 10% of people had a rebound after their symptoms were gone. So not just improving, but actually gone. And then 1 to 2% of people had a rebound, both in symptoms and in viral load. So I do think it's worth everyone having some awareness of this and that you're not necessarily totally done when you think you're done. And yeah, there's definitely some science lessons in here in terms of anecdotes like you hear on Twitter. Those are a great way to generate hypotheses, but they don't really give you a good sense of how common a phenomenon is, because people are more or less likely to speak up about their experiences.
Right, or its specific cause. If it is the Paxlovid, or if this is, I mean, maybe it is more common with Paxlovid, but it does seem to be something that happens even in its absence. So bottom line I'm taking away is, yes, high-risk people should be taking Paxlovid. It does actually help lessen the risk of hospitalization considerably. And, this rebound situation is emerging.
Oh yeah, someone asked the time frame for rebound illness. I don't know if I mentioned this. So average was about 9 days after resolution, but some people were sooner and some people were later than that. So it's a while that you have to be vigilant. So we're about halfway through our time, Malia. So let's move on to back to school, which a lot of families are thinking about right now. So how should parents be thinking about masking and back to school? Because we're probably not going to see a lot of mask mandates this year. How are different nerdy girls approaching it? That's one of the questions that came in. How are different nerdy girls approaching it? And one of our readers suggested she was going to do a Smokey the Bear approach, which I quite liked, and sort of tailoring your masking strategy to the current environment. So what are your thoughts on that, and then some of the polling that you've done in your colleagues?
Yeah, so I agree with you. I think this year especially with the guidance that came out yesterday, we're very unlikely to see mask mandates required in most school settings. CDC's attitude towards the pandemic at this point does seem to be that we're relying on individuals to figure out their own risk and risk tolerance, and to quarantine and test themselves as necessary. For example, the new guidance has no more tests to stay, and no quarantine after an exposure. So I don't know. It's interesting. One of the readers asked here if it's disappointing to see the CDC guidance come out that does have such an individualistic focus. And I think it's a matter of opinion. To me, it is a little bit disappointing. But in any case, many schools. So what are we going to do, right? Here we are again on this treadmill. I actually really didn't want to answer this question because I'm just so tired of this. I'm just like, oh my God, do we have to talk about masks in schools again? This is the third or fourth time schools have come back during COVID-19. You would think that they could have a plan by now, but many schools, including mine, have not said what they plan to do yet. I asked those nerdy girls internally to share what they're going to do, what they're planning, and I got a whole spectrum of answers. Two of our contributors in the same city said completely opposite things about what their plans are. One said that they won't have their kids wear masks, period. And the other said she has a medically complex child who's going to be recovering from surgery at the start of the school year. And so she's definitely going to be sending him to school in N95s. A few of the contributors here had a more middle of the ground or responsive approach, like the Smokey Bear approach, something like no masks if community levels are low or medium, masks if they go to high, or maybe masks if a lot of kids are out of the classroom sick, if you get that information from your school. For me personally, my two kids are vaccinated and boosted. We will get them their bivalent booster when and if it's approved for them. And yes, we're going to talk about that in a second. The most vulnerable people in my family have now had COVID. That's my father-in-law, who just experienced this Paxlovid rebound. And, I think I can be really grateful that they didn't get it until after they had had 4 vaccine doses and after there's an effective antiviral that's readily available. That's about the best we can do. So I am going to send my 2 kids to school without masks this year, if that's what the school district decides to do. And if they decide they want to have masks, we will wear masks at school. And just as a PS on this, we've had 2 very low years of influenza. Flu is going to come back with a vengeance this year. So look out for that and get your flu shot. And by the way, masks also prevent influenza. So that could be a good reason to wear one too.
Yeah. Well, thanks for putting that answering that question, even though it was not one that you were particularly keen to take.
I know. I mean, everybody's just tired of it. I think there's just so much exhaustion. Then that is part of what's playing into this. Is like it's part of even what's playing into the school's decision making at the community level. You know, it's like, well, how much can we do? How much more can we do? It's exhausting. So I definitely feel that too. All right. So
yeah, there's a related follow-up question, which is how can you get, sorry, I'm just stripping my words. How can you get a sense of your community risk level? Yeah.
So for those of you who do want to take more of a responsive approach, we had a reader question who asked, is there a way to track the CDC risk level in my county besides going to the CDC website and putting my county in each time, like an app? Well, so that's a great idea. You should make an app. As far as I know, there isn't one. But if anybody watching this knows of one, please do let us know. I'd be really interested. And I'll tell you, if I was going to make an app, I would be looking at wastewater surveillance data at this point. We do not have any systematic COVID-19 surveillance in the great US of A. So when most people are using antigen tests to self-diagnose at home, I think we really don't have a clue how many cases are in our communities. And so those CDC community risk levels are, at best, a guideline or a suggestion, and at worst, useless, right? So I'm pretty wary of using lab data to make calls about when to wear masks at this point, because I just think our official data is really, really poor.
Yeah.
The wastewater surveillance data are included in the CDC community risk data. So they're in there. And I'm going to put the link directly to the wastewater surveillance data. What you're looking for, it's a terrible website, but what you're looking for is the wastewater metric map. And then you put in your state and county, and then you look for the % change in the last 15 days. The other thing about this is it's not available in all counties. It's only available in counties where they're doing wastewater surveillance. So there are some real limitations both on the website and on the availability of the data. But it's about the best we have for surveillance data right now.
Someone should really do a crowdsourcing app. Like how many, it's reporting your own positives or how many people do you know that are positive right now? Because I feel like that number has actually become kind of useful.
Interesting. Yeah, that's a very interesting idea. And I wonder, somebody should do that. We need some app developers in here to help us out. Totally. The regular kind of federal surveillance systems have really failed us here. So yeah, get some private investment in this. All right, let's talk about these it's contagious. Let's talk about these bivalent boosters. So we are expecting boosters that cover 2 main strains of SARS-CoV-2 to be coming out this fall. And the 2 main strains are the OG strain and the Omicron strains. Do you think it's worth waiting for a booster that has both?
Well, first of all, if you're under 50, you pretty much have to wait. And unless you have some special vulnerability. So for those that are vulnerable and are eligible right now, I really don't think there's a one size fits all. And I don't think we know yet the exact date in the fall, because fall is kind of a vague term.
Yep.
So a couple of things to factor into your decision making here. One is that the OG booster is still really good at preventing severe disease. And it even does help reduce infections to some extent. So it has a lot of value. And so we also don't know exactly how much better the bivalent boosters are going to be. So far, we've mostly been measuring antibody responses. And what we've been seeing is about a 2-fold increase in antibody responses for other bivalent boosters against, whatever they were designed against. So you're expecting about a 2-fold better boost in antibodies, but we don't really know what that means clinically. And so just as an example, the data on a booster developed against OG and BA1, they looked at how well that performed against BA4-5. And they found that if you used the unoptimized, sort of just the OG, you would get a 3.5-fold increase in relevant antibodies. But if you use the optimized booster, you'd get a 6.3-fold increase. So it's really hard to know what that translates to clinically.
Yeah, because 3.5-fold increase could actually be plenty.
Yeah, exactly.
Right?
So
And
we
the
don't know the
extra
threshold. It's probably like a threshold effect. Like you need it.
up
Yeah.
to 6 might add nothing
Right.
to your protection.
Right.
We don't know.
Is that just icing on the cake, or are you passing some critical threshold for protection? So we really don't know. It's not that you're going 0 in one case and a bunch in the other. You're going from pretty substantial boost to really substantial boost, right? So we just don't know. And we also don't even know what variants are circulating in the fall, whether it's BA4 and 5 are still going to be dominating the landscape. So the questions that I recommend asking yourself is really around the opportunity cost. So what is the opportunity cost of not getting boosted now? And that really comes down to what is your personal risk of severe disease? So if you got COVID, how bad would it be? That depends on your health conditions and your age. And then how exposed am I in your own life? Do you want to have the ability to be out and about more now, or you have special things planned, weddings and so on, where you want to be protected now? And then, how robust is your current level of immunity, which really comes down to, you're guessing there, but if you recently had an infection, or, your booster was relatively recent versus it was in January, that's kind of a different story. So those are the things to really ask yourself, is like, how bad would it be to get it now? And how likely am I to get it now? And you can kind of guesstimate some of those things based on your personal situation. And so it really is not a simple answer, but I think most of the nerdy girls are still leaning towards seize the opportunity now, given that, the severe outcome protection is still good with the original. If you knew it would be out September 1st, then probably that'd be different, but we don't know for sure when it's coming out in the fall. That's the way I look at it. Anything to add there?
Interesting. Yeah, I mean, I think it is really, this is the question on everybody's mind, should I get it now or should I wait? And I agree. I think now is better. We are in the middle of a surge, I believe, based on what limited data we have available. And so I think it's worth protecting ourselves now. Take the bird in hand. And as you said, we don't really know how much better the bivalent booster is going to be. I think what people worry about is that if they get the booster that's available now, they won't be able to, they'll lose something in the future. But actually, I think probably you'll be able to get that bivalent booster the next time you're eligible for a booster. So I think really you can get all of them. You can get this one now, and you can get the bivalent one when it's ready.
Yeah, I think
you might have to wait a couple extra months until you're eligible, depending on when the bivalent gets out. But
yeah, I think if you wanted to do the waiting strategy, you would also have to be willing to choose a lower exposure kind of course between now and then. And it's not just your exposure, it's the exposures of everyone in your circle. So do you see your grandkids and all that? So when you consider your exposure level, it's not all entirely in your hands.
Right.
So we should probably continue on to who's going to be eligible for bivalent boosters. Do you think our kids going to be able to get them, and what are they saying about expanded eligibility?
Yeah. So am I supposed to answer this question?
Oh, I was hoping you would. Do you know?
Do
you know the answer?
I was expecting you to answer it, but I can. Who's going to be eligible? So right now, we don't know if kids are going to be eligible for a bivalent booster at the same time as adults or not. There's a fair amount of confidence that adults, so people 18 and up, will be eligible for a bivalent booster at some point in the fall. So like sometime between September and December, say. For kids, it's completely unknown. We do not know when or if kids will be available, will get a bivalent booster, at least this year. Eventually they likely will. My kids, as I said, are vaccinated, and we went ahead and got them boosted because I think the booster in hand, especially for that first booster is super important to achieve optimal protection. And so for kids, it is really important, I think, to get the booster we have now rather than wait for some, totally unknown future when we might be able to get them a bivalent booster. So who among the adults will be eligible? We just don't know if it'll be rolled out for people who are, in a high-risk age group, or if it'll be available to everyone. We just have to wait for the guidance to come out on it.
Thank you for squeezing in one more answer. Do we want to do
Yep.
speed? Do we want to do like a 30
Yeah,
second
let's
speed
do
round?
like the speediest speed round we can do.
Speedy speed. Okay. For you, so some sites advise to wait 15 days after a positive test to get vaccinated, and others say 90 days. So who's right?
Yeah, so you should not get vaccinated if you are still sick because you could expose all the people at the vaccine site to COVID-19. But as soon as you're feeling better, it is safe to get vaccinated. You do not have to wait 90 days in order to get vaccinated after you recover.
Okay.
So here's one for you. I've been exposed to COVID for at least 8 days on a daily basis. This came from a reader whose family all had COVID, but she didn't get it. Am I unlikely to get it at this point?
Yeah, so I think in this particular question, she meant if I'm still testing negative after 8 days, did I win this particular battle with COVID? And I think it's all probabilities. So at the 8 day point, it's likely that you've won, but it is still possible that it will show up on day 9, 10, 11. Someone recently posted just anecdotally on a day 12 since her last known exposure testing positive. But I think that's an outlier. So yeah, I think personally, I would start to breathe easily after 8 days, just knowing that most people test peak viral load is 3 to 5 days after you've been exposed. So and then it also depends on the precautions you've been taking. So have you been just like letting COVID kind of run free in your household, and then every day really is a fresh exposure, versus if everyone's been masking and taking super precautions. If it's 8 days since you really have been implementing precautions, that's a different story than, you've been sort of having fresh exposures in between, and maybe you actually had an exposure on day 5, if that makes sense. So I would say 8 days since you kind of had a sort of high risk exposure in your home is a good one. It's still possible, but rare after that.
Yeah.
And for you, so I'm concerned that my 6-year-old will get reinfected from us. So can COVID kind of ping pong back and forth in the same family?
Mm-hmm. So in this case, one family member gets infected, gives it to everyone else in the family, but the 6-year-old recovers really fast. Everybody else is still sick. Is the 6-year-old going to get it again immediately? Very unlikely. For one thing, 6-year-old just had it. Immune system is still on high alert to get rid of all that virus in his system. I think, and also, it's the same strain, right? There's no antigenic escape from the COVID that you gave to him and that you still have. And so I think it's really unlikely that your recovered household member is going to catch it from you again when they caught it from you in the first place, or maybe you caught it from them.
Yep. So that's all the time we have for today. Thank you for joining us. I think we squeezed in a lot, so hopefully,
I think so. Can I have like a big
that.
picture reflection here before we close out? A lot of these questions I was just noticing as we were talking, have the problem of people want a yes/no answer to a question that's actually really complicated. And this has been a theme for me throughout the entire pandemic. There are so many instances in which we really just crave a yes/no answer. Should we wear masks to school or not? Should we wait for the bivalent booster or not? Can I still get COVID 8 days after all my whole family has had it, right? So many of these things are just not yes/no answers. It's just, it's frustratingly complex. And so
yeah,
that's life, right? That's how science works.
Yep. Malia, did you want to say anything about the reproductive health area?
Oh, yeah, I do want to plug our new squad. So Dear Pandemic has brought on board a team of writers who are new contributors at Dear Pandemic, who all have amazing, really deep expertise in aspects of reproductive and sexual health. And so this is, we have posted on non-COVID topics to some extent. I routinely post on other diseases besides COVID-19, and we talk about sleep and other immunizations and pregnancy and other things. We're going to start talking a lot more about reproductive and sexual health, thanks to the contributions of this new team of experts that we have brought on board. So it's a really exciting time, and we are inviting your questions specifically on those topics in our question box, which is on our website at www.dearpandemic.org.
Excellent. Yeah, so that's all I wanted to say to wrap up as well. Just give us your questions, and we'll look through them as we form our plan for the next live Q&A. And finally, always seek the advice of your healthcare provider if you have questions about your specific medical condition. So thanks for joining us.
Yeah, thank you.
Time.
Thanks for having me. Bye-bye.
All right, take care.